After done with this, we make sure we lubricate it. After lubricating, we have to put this to the patient, and then when putting this one, make sure we hold it and then gently insert it to the patient, and then we should not do it with a twisting technique because it might lead to complications. So we just have to insert it smoothly, directly, until if we feel any resistance. First thing is we either have to pull it a little bit, or we have to let the patient cough so that the vocal cords will open up. So assuming we did it the suctioning, so we have to suck it, and then we will notice secretions coming in with this catheter. And then by doing this, we should not do it more than 15 seconds. It's ideally we should do it less than 15 seconds. So another thing is, if we want to do multiple attempts, first is we have to hyperoxygenate again the patient, let the patient rest for a few seconds, and then when doing multiple attempts, it should be not more than 3 attempts to prevent any complications. And then assuming everything's done, we have to remove it carefully with this, and then have to dispose it together with the sterile gloves, then dispose it to the proper waste disposal. And then we have to resanitize or wash our hands, and then wear another clean gloves, and then wearing another clean gloves, make sure everything in here is being disposed, and then make sure we turn the regulator off, and then we have to put it in here, and then with the device, oxygen device, make sure we always put it in place to the patient, inspect for any leaks, or make sure the bag is fully inflated. And then with the nasal trumpet, we can leave it there for about a day, especially if there are frequencies that the doctor would like us to suction to the patient. But make sure we already put it with the oxygen device. So once everything's done, we always have to do our post-assessment, obtain vital signs to the patient, make sure we auscultate it so that we will know that if the breath sounds were already being cleared up, or if there are any adventitious breath sounds present still. So once everything's done, once everything's disposed, make sure we sanitize our hands, clean our hands, wash it, and then dispose or remove the appropriate PPE that we wear. And then once outside, make sure we chart everything, what we're doing to the patient, what our observations is, if there are any improvement or not, and then make sure we communicate if the physician is present so that they will know, and even the nurse in charge.